Welcome to the Family Medicine Information Session. I'm Dr. Schultz. I'm the Program Director, and I met some of you last night at the social gathering, which was lovely, and I look forward to meeting more of you today. So, welcome. We're glad you're here. It always seems to me that CaRMS comes at the worst time of the year. You're going to see places not looking their best. I'm really not a winter person, you can probably tell that. I do want to reassure those of you who are not from southeastern Ontario and don't know it that it looks better most of the year than what it is outside, although this is not bad for this time of year. So I am going to give you about a 20-minute overview of the big umbrella picture, the whole Queen's program, and then each of the site directors. So Wei-Shi Pang is our Oshawa site director, Jeff Hodgetts is our Kingston site director, Kim Curtin is our Peterborough site director, and Bob Webster is coming soon, and he is our Belleville-Quinte site director. So each of them will give you a session about their sites as well. Dr. Jeff Hodgetts is also our PGY3 Enhanced Skills Program Director, and he's going to tell you about the Enhanced Skills programs that we have to offer at Queen's too. What I'm going to do is I'm going to talk to you about two things, and the first is why family medicine, and then the second is, if family medicine, why Queen's. For many of you in the audience, I think you're quite decided, you know, family medicine is my career choice, that's what I want to do. But for others of you, and it's a stressful time, you know, you're still trying to make that decision. And I think it's really important to put a lot of thought and effort into that. I was reflecting back on the number of years, and it's more than I might want to say, but I've been a family doc for over 25 years now. And I can honestly say it is a profession I still love. I'm excited about my work, and I think that's because it's a good fit for me. So what do I think is a good fit for you if you're considering family medicine? There is a difference as to how specialists and generalists think. And we need both, and it's important to find, well, what's my style? So if you like that sort of thinking really broadly about a potential differential diagnosis, problem solving early in the course of things before things get really settled into a pattern, that sort of stimulation of thinking like that, family medicine is very exciting intellectually. If you like that continuity of care, you like establishing those long-term relationships with patients, coming to know them very well, and because you know them really well, once you've figured out what's going on, you can really personalize their treatment because you know this person and you know this particular option in this list of choices is the thing that's going to work for them. That's really creative, and that's very satisfying. And if you like that, I think family medicine will be good for you. A lot of our residents, they come in and you say to them, well, why do you like family medicine? Why did you want family medicine? They say, you know, I was going through all my rotations, and I love my peds rotation, and I love my geriatrics rotation, and then I really like psych, and I really like surgery, OB, it's all good. That's the joy of family medicine, is you can do all of that. So if you like that variety, family medicine is a great choice for you. And if you choose family medicine, it's also a really good lifestyle. You honestly will have the skill set at the end of this. You will be a very comprehensively trained physician that you can work anywhere, and there are opportunities all over the world to bring those skill sets to. You can work part-time, full-time. I started out part-time when my kids were little, and as they got older, I sort of did more and more, and now they're off at university, and I'm working full-time now. So I've been able to tailor my career so that it was a good fit with my family as the years went by. There's a huge variety of types of practices out there that you can get involved with. A lot of people are now working in healthcare teams, which is nice because it is a sharing of care and call groups, so that when you want to go on holiday, you want to go to a conference, you've got that backup. So it's a nice balanced sort of a life. And it used to be there was a huge discrepancy with what specialists made and family docs made, and that has really narrowed, so you can make a really nice living as a family doc as well. So it's really a great vocation career if this is the right fit for you. If family medicine is the right fit, well then where do you want to train? And I believe that all of our training programs across the country are going to train you very well to be a family doc. If you are a self-motivated learner, you are going to get trained well no matter where you go. So then I think it's important that you find the program that has the right feel for you, the place where you're going to work has the right feel for you, and you go for that. So now I'm just going to tell you about family medicine. That's enough, or at Queen's. That's enough of the other sites. I'm going to tell you about Queen's. The bottom line is we feel our program will train you to be very competent, comprehensive family docs, and you are going to have fun getting there. We have a great group of residents. You're going to meet a lot of them over the course of today. This is a picture from our first, we opened 2 of our new sites in 2010. This was our inaugural all-sites academic day up at Campo Canto, where all the residents from all the sites came together. It was a lot of fun. People learned a lot of interesting things, and there's a lot of great things that happened through the 2 years, lots of collegiality, that it's a fun program to be in. We really believe, and this is our motto, train at Queen's, work anywhere, and that is true. We have tracked our residents out. Our residents are working anywhere from small town, rural, to big city, urban, provincially, nationally. We have residents working all around the world. And we have one resident who works at Nassau, so we also say we can train you to work universally as well. So lots and lots of options. We have, I think, a very exciting, innovative program, and we really are leading change in family medicine education across the country, and that's for 2 reasons. There are 2 factors that have really influenced how the program at Queen's looks, and one is the College of Family Physicians. So there was a lot of thought that went into what do you as future family physicians need, and the college has thought long and hard, lots of smart people thinking about this. What's the best type of education to provide you so that you are going to be very competent, very good family doctors at the end of your training? And they have come up with a curriculum called the CCC curriculum. Those 3 C's stand for a training that's going to provide comprehensive training for you. You are going to get continuity, so you're going to get continuity of patient care, so you come to understand that long-term therapeutic relationship. Also, though, for your learning, continuity of supervision and continuity of curriculum. And the 3rd C is that it is very family medicine-centered training. You're being trained by the type of people you want to be when you're out there in the real world doing your own thing. So the college has said this is the way family medicine programs need to provide their training. We grew a lot in the last 7-8 years. We went from a training program of about 50 residents to over 150. And with that growth, we realized we could not confine our training to our one site here in Kingston. We needed to expand. With that expansion, we became a distributed program, so we now have 4 sites. Our Kingston Thousand Islands site, our Belleville Quinte site, Peterborough Kawartha, and Oshawa, or you'll hear the acronym QBAL, which Weishi will describe for you what that means. So with that distribution, with starting up 2 brand new programs, it made total sense to make those programs CCC centered. So our new programs were made from the ground up to embrace those concepts, and that's why we're leading across the country, because we were in the position to do that at the time when it needed to be done. We've significantly changed our Kingston program to also embrace those concepts, and so when it comes to curriculum and evaluation, as I say, we really are leading the way across the country. So Kingston remains our biggest program. We have in the first and second year, we have about 100 residents. Belleville and Peterborough each have 6 per year, so are at 12 residents, and Oshawa will start with 8 and so ultimately end up with 16 residents. Each of the sites, we centrally set objectives, so the Queen's umbrella, centrally set objectives, centrally set evaluation standards, but each of the sites delivers a program that's very different because they really are utilizing their local strengths and resources to deliver you a really excellent program. This is just a brief overview. You're going to hear more about each of the programs specifically, but this is an overview of how the programs are structured differently. So up in the top right corner is the Kingston Thousand Islands program. It remains still a pretty rotationally based program, where you are doing blocks of experience. So a block is 4 weeks. You're going through blocks of experiences. How we've changed it is you repeatedly come back to your home family medicine clinic through your first year, and you weave some horizontal experiences through that family medicine time. The other 3 programs are much more horizontal. In all of the other 3 programs, except for a few block rotations like internal medicine, like your electives, like your rural family medicine, you will come back every week to your home family medicine clinic for a day and a half to 2.5 days a week. And the other days of the week will be done doing experiences that we feel are really going to train you well to be a family physician. So in the Peterborough program, those other experiences are arranged in blocks. So you'll do a day and a half a week in your family medicine clinic, and then you may do the other part of that block is spent doing surgery or doing obstetrics, that sort of thing. Our Belleville program and our Oshawa program, what you'll do is shorter experiences. So you might have a week of working with a surgeon and then a week of doing obstetrics, and those repeat through the whole of your 2 years. So slightly different setup to the 4 programs. So we say 4 sites, 1 vision. We are delivering differently, but under a centrally set list of objectives and evaluation standards, all of them teaching to the CCC curriculum, and we are really providing a lot of support for your learning. So all of you will have subscriptions to UpToDate that you can use through your training. We have learning facilities that are second to none. So Queen's as a medical school has been around forever, really. And so was the medical school, very, very old. But we have this brand new building that opened in the fall of last year. The Queen's Medical School is a lovely facility, and the simulation labs are amazing. And we use those simulation labs for a variety of different teaching purposes. At the same time as the Queen's new medical school opened, in Oshawa, the Learn Center opened. And the Learn Center stands for the Lakeridge Health Education and Research Network Center. Queen's Family Medicine provided a good amount of money to support the building of that facility. Again, cutting edge simulation labs in that facility, lounges for the Queen's Family Medicine residents. It's a lovely, lovely facility that all of our sites can use. So sometimes Peterborough will use that site, and sometimes people will come back to Kingston to use the sites here, the facilities here. Peterborough has a beautiful new hospital. It's a big hospital. It's over 450 bed hospital. Very busy emergency department, one of the busiest in Ontario. It opened in 2008. So again, a lovely physical plant to support some of the learning being done in the Peterborough site. And when we opened our program in Belleville, a building was built specifically for the Belleville-Quinte Family Medicine program there. So this opened in 2010. Again, lovely, lovely facility. So that's the Belleville Queen's University Family Medicine Center. So very good physical plant to support your learning. We are all using EMRs, so you'll certainly get very adept, you probably already are, but very adept at using EMRs. We have a really committed, engaged, talented group of preceptors. So we have preceptors working in the program who are renowned internationally, nationally, provincially. While Rosser is a critically acclaimed international family medicine researcher, Rick Birtwistle was given the CFPC Researcher of the Year Award not that long ago. Ruth Wilson, I don't know if you know her, but she really set up the the family medicine health teams across the province. Jonathan Kerr is one of our preceptors down in Belleville. When he was a resident here, he was given the Murray Stocker Award, which is the award for the resident across the country who shows great leadership skills and real commitment to family medicine. So we've got some really great people who are interested and engaged and wanting to teach you from all the sites. Here are some of them, but there are many out there who really have your interests and are very interested in working with you. The slide on the bottom right is to remind me, so that's Mike Sylvester with no hair, and that's Joey Bonacci with hair. And Joey was a resident in our program and now is a preceptor down in Belleville. So we have a lot of our residents. I think it's a good sign that they must like the program enough that they want to also be preceptors in the program. So we have a number of them who continue on as preceptors for us, which is really nice for us. There's a very good academic to service balance. There is no question that when it's your academic days, your academic time during the week, you get a half a day in your family medicine time for academic teaching, and then we have some 2-day academic sessions that happen where everybody comes back together, there's no question that you're released from your services to do that. We have, on our off-service rotations, where you're working with specialists, there's a variety of, there's a lot of one-to-one teaching. So the nice thing I think about our program is, yes, we're small, but we have lots of patient variety, we certainly have an adequate number of patients for you to learn well with, but we're small enough that you're really getting personalized teaching. So a lot of it is one-to-one teaching. If you're on a team, it's a small team. Like you're not way down on the bottom of the totem pole. It's a small team, and you're going to get lots of attention to your learning. I should also remember to say, if you do go off-site for a program-directed rotation, this question came up yesterday, there is accommodation for you if you're out of your home site off on a program-directed rotation. You are also a very active member of the team. Our specialist preceptors love you guys. Our family medicine residents are very strong residents. And our specialist preceptors know that. They love having our family medicine residents on their service. And they really are committed to teaching you the skills you need as a family doctor. So it works really well, very family medicine centered. We have a lot of innovative learning opportunities for you. So no matter where you go across the country, it is a CFPC mandated thing that you will get a neonatal resuscitation program and ACLS. So that will happen no matter where you go. We are one of the few programs across the country that offer our alarm course for obstetrical skill development for all of our residents. We have a number of procedural academic days, so MSK Day, iSkills Day, where you get lots of hands-on stuff using some of those great sim facilities. This Nightmares FM course is a course that we're really proud of. It's a Queen's course. We piloted it last year. It was so successful, we're offering it to all of our residents this year. This is those things that keep you up at night, that give you nightmares at night when you're on call thinking, oh God, don't let that patient crash. Oh, you know, and this will train you what to do with that. So the suddenly syncopal patient, or the suddenly dyspneic patient, or the cardiac arrest, those nightmare kind of situations, you get, using those sim facilities, training in how to do that, that repeatedly building on those skills through the 2 years that you're here. We also offer an opportunity to learn wilderness medicine, and this is a pretty fun opportunity. So every 2 years we alternate. 1 year we do the Campo Canto experience, the next year we do the wilderness medicine experience. And this is up in in Temagami, which is up in northeastern Ontario. This is Dr. Glenn Brown, who's our department head, teaching on the shores of Lake Temagami about wilderness medicine. And so there's a lot of interesting things that you learn medically. There's a lot of other learning that goes on. So these are some of our residents, I think, cheating because using this sail that they derive, they actually lead their preceptors back to shore in this canoeing little expedition. The art of self-care, so this Zen-like pose from some of our residents on the shores. You'll meet some of them today, I think. And I think this was after a little unsanctioned communication and collaboration that might have happened during some of the evening social events, a little realization after. So it's a really fun weekend that you'll have an opportunity to do if you come here. All of our residents are given the opportunity to develop their skills as teachers, so residents as teachers course is offered, and certainly an opportunity to teach through your training. We also have an opportunity for you to build up research skills. Every resident will be part of a critical inquiry exercise. There is also journal clubs that happen at all of the sites. And you do a resident project. So a resident project may be a research project, and we will give you the training to do that research and the support to do that. But lots of choice with that. So we have a new option of doing an advocacy project, and some people will be coming up with some really innovative things for an advocacy project. You can develop an IT, like an app. Some of the apps the residents have developed, they've actually marketed now. So there's some really fun things that you can do with the resident project. We have global health opportunities. So we have a rotation in Moose Factory, which is a community on James Bay and definitely is a global health experience. We also have international global health experiences. So you can do pediatrics in St. Lucia. We are developing experiences in Tanzania and Zimbabwe, and as well, residents have gone all over the world. Eva Perky is our person who oversees our global health international experiences. She does a great pre-departure session with residents going overseas, post when you come back, debriefing, to find you communities that are safe and you're going to learn well with, but also that you're going to support the community and it's not just going to be medical tourism. We have a lot of enhanced skills programs, proportionately a lot for the size of our program, and Dr. Hodges is going to tell you more about those later on. And finally, we are very resident-centered. We love our residents. They are a very collegial group. I think you're going to see that through the course of today. The program staff as well is very engaged and involved with your learning. Some of you may have met some of our program staff up at FMF in Montreal, and some of them you will have met when you checked in today. People very much working to make your training excellent for you. If you come to Queen's, every one of you will have an academic advisor who will be your person who will oversee your education through your 2 years. You'll meet with them every 3 to 4 months. They'll look and see how are things going, how can we set things up for you down the road to meet your needs. So a very supportive person for your learning. As well in non-evaluative roles, so your academic advisor is also overseeing your competency development. We have 2 people for you for your well-being. So Dr. Rick Rowland is a family physician in our department. Melissa Andrew is a psychiatrist who works at Queen's, and both those people are available if you are running into any difficulties, personal difficulties, some career counseling, that kind of stuff. We work hard to meet your needs. It is very true that happy residents make for happy programs, so it's in our best interest to work hard to meet your needs. So we really have very flexible scheduling. That's really due to the site assistants. They work hard to make that happen. We also are very flexible around parental leave, so if that becomes a need through your residency, it's not a problem to adapt the programs to that. You will have electives no matter which program you go to, and those are set in place for you to really make sure that your competency in all the 7 CaRMS FM roles is fully met through your training. Great exam prep, lots of really fun social gatherings, and we really do see you as more than just a resident. Your well-being and how things are going for you as a person is very important to us. So you say, yeah, you're the program director. If you can't toot your own horn, like who's going to do that? So there's me saying how I think our program is great, but I can offer you a substantiation of all of this. So every program across the country, be it Royal College program, College of Family Physicians, it is a requirement that all programs every 6 years have an accreditation process done, which is the external bodies coming in and really looking at your programs very closely to make sure that you're providing a great educational program. So Queen's went through that process in the fall of 2011, and I can say we did really, really well with that. Almost all the Queen's programs were fully accredited, and all the Queen's Family Medicine programs fully accredited. Queen's in general, the reviewers were very complimentary about Queen's in general, about how this is the reason for our School of Medicine, is the training of our residents, and it's really what people are engaged and involved with. And these are the comments that were made about the family medicine programs, and I'll just let you read those. I think sort of supporting all I've just been saying to you. So it's very nice for us to get that, especially with our new programs, to get this, the college coming in and saying, you're doing a great job, these are great programs. We are very pleased with our exam results. We have exceeded the national average in our last 2 exams. So in the spring, we had a 97.5% pass rate. In the fall, we had a 100% pass rate. So people are working hard and they're getting what they need to do well on their exams. And many of our residents, the vast majority of our residents who choose to do a 3rd year are placed. 15 to 20% of our residents choose to do a 3rd year, and almost all of them get into a 3rd year program. So again, very competitive to get into 3rd year programs at the end of your training.